The weekend has confirmed the upward trend of COVID-19 in Spain. In just 2 days, the regional health authorities have diagnosed 32,607 new positives, placing the country's cumulative incidence at 204 cases per 100,000 inhabitants. The situation is of very high risk according to the epidemiological values of the Ministry of Health and requires forceful measures against a possible fifth hello from COVID-19. Although, on this occasion, decisions will be made without a single command. The new wave of infections, which is not expected to lead to hospital saturation, is faced without the legal protection of the state of alarm, which did occur in previous epidemiological peaks such as that of February. After the fall of the state of alarm, the Department of the Minister Carolina Darias tried to implement a mandatory epidemiological traffic light with a series of guidelines: open the terraces to 100% of their capacity or reopening of the nightlife, linked to the epidemiological situation of each region. The block confrontation that several autonomous communities staged against health, to make the indicative and non-binding epidemiological traffic light, it ended with the success of the wayward regions and, correspondingly, without a single criterion to close or open bars. Now, there is a new wave of infections linked to macro outbreaks among minors, but health has its hands tied. It cannot unify restrictions without returning to the state of alarm. Although some regions have confirmed to this medium that they will go to Interterritorial Council of the National Health System, CISNS, on Wednesday asking for union and projects in order to stop the new cases, everything will depend on the will of each community. And it is that, the decisions to limit the mobility between autonomies, the curfew, the opening of the hotel business or, for example, the return of the mask to the open air, they depend on each autonomous community. In some cases, they even have to face their own courts of justice because they reject the measures they have taken, as happened with the preventive confinement of young people in Majorca. At the moment, it is the regions most affected by the incidents among the youngest that are beginning to take measures to contain the spread. In Cantabria, nightlife establishments in several cities have been closed to the public to try to stop the propagations linked to celebrations in discos, nightclubs and bars. In addition, the president of Cantabria, Miguel Ángel Revilla, it is going to ask the Interterritorial Council to vaccinate those under 30 beforehand. Measure that was already rejected last week. Health has ruled that the current vaccination strategy in which age is a determining factor must be followed. Galicia it has also advanced that it will take measures related to the restrictions of hospitality and nightlife. It will review them this Tuesday, and in Castile and Leon they have begun to carry out mass screening tests among young people from very affected provinces, such as Leon. The vice president of the region and Dr. Francisco Igea, has ensured that although this wave does not translate into more income, it can occur, despite age.